Do you find yourself wondering if you have ADHD? Often you hear certain things and you think that sounds just like me. Did you know that rejection sensitivity can be a sign of ADHD? A lot of people don't realize that. So let's dive into how ADHD shows up in adults and how to get diagnosed. Hey, I'm Robyn. I'm an RN and a life and focus coach with ADHD, and I have a husband and 2 kids with it as well. So let's cover some of the most common ADHD symptoms and then some of the less common. Now grab your tea and let's go. Oh, and obviously this is not meant to diagnose anybody. You know that you need to see a professional about this, but we'll chat about that later on because there are a couple of nuances there. So one of the biggest and most commonly known symptom of ADHD is inattention. So quite often we can make careless mistakes at work or in other activities. Not following through on instructions. Maybe when we were kids, this looked like having trouble doing jobs that had more than one step, and it still can as adults. Quite often our memory is not the greatest. Why did I come in here? What was I just doing? Gosh, I can never find that phone. We can struggle to do anything that is boring. People with ADHD not only hate boredom, they rarely can even complete the tasks that are boring. We can also be very easily distracted and have trouble getting and staying organized. And often we don't seem to listen very well when we are directly spoken to. Hey Robyn, how are you? Hey, I'm good, how are you? Oh, I've been good. Yeah, I just started a new job. It's really fun. I work with really awesome people. It's this really neat old building with this architecture. Oh gosh, I still have to get the groceries. I need to call the doctor, take the cat to the vet. Hey, are you listening? Oh, I'm sorry, what were you saying again? Now, people with primarily those symptoms can be diagnosed with primarily inattentive ADHD. Now, the hyperactive part with ADHD could look like feeling a little restless as an adult. For me, sometimes in a Zoom call, I can really struggle to stay focused, especially if I'm not an active participant, like if I'm just watching, and I have to turn off my camera sometimes just because I am like fidgeting and moving around so much. My husband, for example, he can't sit for very long in boredom at all. He really can't handle like 10 seconds. If he comes in the living room and I'm maybe watching some like homesteading thing on YouTube, he'll just be like, okay, I'm leaving, and I'll be like, wait, it's got like a minute left, and he'll be like, oh, I'm just gonna go and do something quickly. Like he can't even wait that long. Quite often we are really busy people. We don't like to sit down for long. We're always on the go, staying busy, and that doesn't always mean that it is productive. What you doing? Oh, I'm gonna make a paper mache Crumpet the cat. Why? Because it'll be fun. It might be hard for us to wait our turn in the line, and we might talk a lot. That really was me in school. One of my biggest symptoms was just that I was chatting all the time to my friends. So of the Harry Potter franchise, I would say that my very favorite character
is definitely Hermione. I mean, I love Hermione. Actually, wait, I love Snape. Some people don't like Snape, but he was actually so great. And his character was so complex and so deep. But Hermione, she was so cool. I just really liked her, sort of like the way she
We might fidget a lot. As children, this might have looked like squirming in our seat in school, getting up a lot, talking a lot, blurting out the answer. Oh, I know the answer. I know, it's Queen Victoria. Queen Victoria. And if you mostly have those symptoms, it could be predominantly hyperactive, impulsive ADHD. Now for me, it's a combined presentation, which is more of a mixture. We have to talk about childhood just for a minute. Now you might see some things here that you recognize in your kids. This is primarily for adults, but part of being diagnosed currently does involve having symptoms before the age of 12. So when I was a kid, I really struggled to pay attention in class, which definitely held through as an adult. But in school, it was like this. Robyn is very bright, but she would do much better if she would just apply herself more. And they said that a lot. There are also some things called soft signs, which are being discussed more and more in people with ADHD. And this can be more common in women, but totally can be seen in men as well. Hypersensitivity is a big one. We can be emotionally sensitive, we can have strong emotions, and we can absorb feelings of others. Guilty here on that big one. We can also be highly sensitive people, which I am as well. For the longest time in my life, I did not realize other people were like that, and it also made me really question a lot of their behavior. We can also really be sensitive to sensory overload. We can be sensitive to touch, to temperature, claustrophobia, noise, lights, chaos. Funny enough, my husband, he's the opposite. He loves lots of noise. He is happy to have the TV on, have something playing on his phone, and have like a radio in the background. I am the exact opposite. I just want one thing on. And I also am very sensitive with my clothing. I don't like how certain things feel. Sometimes it feels scratchy or like there's, something poking me. And that is another thing where my husband's like, I do not know what you're talking about. I never feel like that. We can also feel overwhelmed or overstimulation a lot of the time. So sometimes we'll go into maybe like a busy shopping place or something, and we can be overwhelmed by the sights and the sounds and the smells. Another thing can be OCD-like coping skills. So a lot of us, we can overcompensate in the management of our ADHD, and we can also get some sort of like habits in, like checking things multiple times because we have just dealt with it for so long. Now, this is different than true OCD, which is caused by anxiety, but the ADHD can also cause anxiety, so it is complicated, and you know why you need to see a professional. And also hyperfocus. We can hyperfocus so good when we have ADHD. We can channel that focus. We're in the zone and nothing can stop us. I mean, this is when we are holding ourselves, trying not to go to the bathroom. We love that dopamine fix that we get from a good hyperfocus session. There can be some negatives to it, but overall, it's great. There's also a rejection sensitivity dysphoria. Now, Dr. Dodson, an ADHD specialist, he coined this term and describes it as an internal state of arousal that prevents the people from simply relaxing and enjoying life. We can feel incredibly vulnerable. There are medications like guanfacine or clonidine that can help with this. One of my kids ended up taking guanfacine and it helped a lot with this condition. Now, to get diagnosed, you need to talk to your doctor. Talk to your general practitioner first and see what they say. When I talked to my doctor, she said, "Oh, what makes you think you have that?" Even though I had really had these symptoms my entire life. "Do you think you're going to take medication for this?" And I thought, whether or not I'm taking medication for this doesn't mean I shouldn't be diagnosed. Say you were like, I don't want to take medication, maybe some other treatment would come out of the woodwork in the future. There are a lot of things we can do. I mean, medication is like first line treatment, but really knowing is a big deal. So if you have a doctor who's sort of not really interested in diagnosing you, then definitely look into finding another doctor. Get a second opinion. You can talk to a psychologist. You can talk to a psychiatrist. And it's funny because they often say adults with ADHD really should be seeing a pediatric psychologist. Really, that's probably not normally something you can do, but quite often doctors only have one actual lecture on ADHD, and only a small part of that is about adult ADHD. There's way more information coming, but they're a little bit behind on that. Now, women are really unique when it comes to ADHD because for the longest time, they thought it was primarily a male disorder, even though just about 50% of people with ADHD are female. So check out this video here, which is all about how we are all affected differently. Thank you so much for watching, and I will see you next time.